right, welcome to the Dr. America Show here on the WEAC Radio Network. I am your host, Dr. Sanjeev Sriram, and we've got a great show today lined up. I'm really excited to present to you guys some really great information. I'm wearing green because this is May. It is National Mental Health Awareness Month, and green is the color to recognize and support our friends and family with mental health problems. So we're going to talk about that in a little while, and I will clarify a little bit more about the Green Lantern t-shirt that I'm wearing today. But first, I was actually really, I was really surprised, and I was pleasantly surprised to learn that our friend Louis Lang, I know that I've talked about him on the show before. This is a gentleman in South Carolina who has been facing some pretty serious health problems, including a loss of his vision or diminishing vision. And he was initially very skeptical about the Affordable Care Act and had some trouble with it, and then encountered some of these health problems and realized that because of the way that policies are playing out or not playing out in South Carolina, he was without health care coverage. And so he started a GoFundMe campaign, and his story has gone viral over the internet. And I know I've talked about him on the show before, and I reached out to him to let him know that I did support him, that I felt that, his cause is illustrative of why we need health justice in America. And I sent him, the link to our show. I sent him, an article that I had written for the Huffington Post. And I invited him. I said, if you want to talk about this on the show, you're more than welcome to join us. And I was totally surprised when he, called back and said, yeah, let's chat it up. So I'm very excited to, interview him on the show today and, and have him, describe his own experience to you guys, because I think it is very illustrative of what everyday Americans are encountering when it comes to the complexity of just getting well in America. So I'm really excited to have him on the program, and we're going to talk to him in just a little bit. And yeah, we're going to cover, after we're done talking with him, we'll cover Mental Health Awareness Month, and then a couple of other news items that have been happening this week in the world of health and medicine and public health. So, Mr. Lang, how are you doing?
Good. How are you today?
I'm good. Louis, thank you so much for joining us on the show. I'm really excited to have you and have you share your experience. I know that the media coverage of your story has generated a lot of talk, but some of it is not always accurate. So I'm actually really glad that you're here to just sort of tell us your experience from your own perspective. Why don't you bring us up to speed about how your health is doing? How are you holding up, sir?
Well, my legs are holding me up. No. Well, as far as my eyes are concerned, the first doctor that I did go see, he was, pardon the expression, a quack. He was just after publicity and not actually to take care of my eyes. I do have my next appointment is scheduled for June 9th with another ophthalmologist that comes highly recommended. And the other thing is unfortunately I'm starting to show early signs of kidney disease.
Oh, sorry to hear that.
And I have an appointment with a general practitioner scheduled for June the 11th.
Okay, so it sounds like, that some of your health conditions are getting worse, but it sounds like you're also going to be able to get a little bit of help too. How are things looking for your GoFundMe fundraiser? Are you going to be able to, afford everything?
I will probably, obviously after I see the doctors, honest doctors, I'll be able to judge that better. But it will have to go up because just for what the doctors have been telling me about my eyes, even the quack, that it is going to be a slow, long process. Several different surgeries, not what, originally was thought up. and then on top of that, now the kidneys. But that decision we made. Obviously, after I see the doctors and I have a better understanding of things. So, but yep, unfortunately, that will end up having to go up.
Yeah, and I mean, the thing that I find so striking about your story, and that I think that really I find heartbreaking because it's a story that's happening in America, is that at the same time that you're dealing with the burdens of these health problems, those health problems are causing you financial problems, which I feel that it's really unjust for a country as rich as America to put you in a position like that. Do you think things would have been different if you lived in another state that maybe expanded Medicaid or worked with the Affordable Care Act a little bit more cooperatively?
Oh, 100%.
In what way? Like, what do you feel would be different?
Well, if we had lived in a state that had expanded the Medicaid, then obviously I would have health insurance. Because, see, I did try to sign up for the ACA last year, but it was just too complicated, especially as far as with the type of work I do. My income varies week to week, month to month. So if we were living in a state where things were a lot more simplified, or they had expanded Medicaid, I wouldn't have to. I would have no need for a GoFundMe account or anything like that, and I would have probably already been back to work, or well on my way back to work.
Oh wow! So I mean, this is actually affecting your your work career.
Oh yes, I do handyman work, and also I work fixing and maintaining foreclosure properties for the bank and for HUD.
Okay. So, I mean, it sounds like, if you had, that your circumstances are unfortunately being decided by, the state that you live in, even though you live in the United States. And, so if you could tell South Carolina Governor Nikki Haley or the South Carolina legislature anything, what would it be? And just to remind you, we're on the radio and, my mom listens to this show. So,
yes, we did talk about that earlier.
Right.
I won't say that.
Yeah, but no, but I mean, like, I'm not asking you to be nice, but if you don't mind just sort of respecting the radio part of it, that'd be great.
Yes. Well, let's put it this way. She needs to stick her head out of the place where the sun doesn't shine. Was that clean enough for you?
Yeah, I think so.
Okay. Now, secondly, politics has no place in healthcare, because as soon as they stick politics into healthcare, half this country is eliminated. Whether you're rich, you're poor, whether you're a liberal or a conservative, it doesn't matter. Half the country is eliminated. So, if she was if she was standing right in front of me right now, I would tell her, excuse me, you are supposed to serve your constituents, not your own personal political opinions.
Mm.
And I actually say that to, all the red states that did not expand the Medicaid.
Mm-hmm.
And that statement actually goes for every politician in the country.
Yeah, I mean, because, I think that what you're touching on is that, healthcare is just, such a fundamental right that, to obstruct it with politics is, it really does, millions of us such a disservice.
Yeah, I had no idea. I knew there was about 5 million, but after watching, I think it was one of your last shows, or excuse me, listening to it, It's like you said it's like the 8 million.
Yeah, so the numbers, I'm glad that you brought up that point because I probably should clarify that the coverage gap is about 4 million people. And then there's another several million that are depending on the federal subsidies. Like those are the,
Okay.
and so when they go to the health insurance exchange and they want to buy health insurance under the Affordable Care Act, in order to keep that insurance plan affordable, a lot of Americans are, getting the help from a federal subsidy. And I mean, there are millions of those folks. So, like there are millions of folks who are kind of, stuck in this limbo. And they're very much in situations like yours. Their incomes, fluctuate and they go back and forth, and they're just trying to, make ends meet and get by.
Yeah.
And I think that I feel you're absolutely right that when governors and state legislators and members of Congress turn this into a political game, there are serious health consequences.
Oh yeah, I mean, the way I see it right now, the U.S. government has become an insurance agent.
And so, but let me ask you this. I mean, we seem to trust the U.S. government to be, a provider of healthcare when it comes to Medicare. Would we be better off if like all of us just had Medicare and it was just simplified?
From the get-go, I've always been in favor of the ACA.
Mm-hmm.
My problem is it didn't go far enough. Medicaid, Medicare, ACA should all be combined into one unit.
Mm.
And I guess that's called. You told me the other day.
Some people call it
single payer.
Yeah. I mean, some people envision that as single payer. There's a lot of different kinds of single payer out there. But I mean, the thing that I really gather from having talked to you, now and before is that, the person who is struggling with their health shouldn't be put in a position where they're having to become a policy expert, a finance expert.
Of course not.
Yeah.
And, and as we've talked before, you've gone to my GoFundMe page and you've been, reading some of the comments and everything else. And one of the comments that really has been standing out over and over again is that people have been asking me to be, quote, the poster boy. And it's kind of funny since I'm 49. For the ACA,
mm-hmm.
So that other people can benefit from from what we've gone through.
Uh-huh.
And first, I've embraced that wholeheartedly. And in fact, I've asked people to call their TV stations and stuff and demand that they put me on because I'd like to be the poster boy for the ACA. But, me and my wife, we were talking about this over the weekend, and we figured out the ultimate way of paying this forward is that we are creating the Louis Lang Foundation.
All right. Tell me more about that.
Yeah, the Louis Lang Foundation is going to be made so that other people that fall into the gap, like I did, have somewhere they can reach out for help. Because, quite frankly, not everybody is a loudmouth Hispanic Jew like me. So this way they have an organization they can reach out to for help. And what we will do is that we will find them a doctor, and the payments will be made straight to the doctor or hospital. So, they don't have to go through what I went through. And like I said, it's going to be called the Louis Lang Foundation, Liberals Helping Americans.
Wow.
Yeah. Talk
All
about
right.
paying it forward.
Yeah. Well, sir, I want to thank you so much for joining us on the show today. I think that, I mean, your story is, I think it's illustrative. I think it's inspiring. I feel that, you're doing, an incredible service to the country for actually like kind of trying to get the record straight about the Affordable Care Act. And, in the midst of your health problems, to actually do your best to pay it forward, I think is very admirable. And thank you so much for coming on the show.
Thank you for having me.
All right, guys. So that was Mr. Louis Lang from Fort Mill, South Carolina. Want to thank him for joining us here on Dr. America on the WEAC Radio Network. So for a lot of folks who have just heard, from Louis Lang directly, what I've appreciated about talking to him on the program and before last night, I had a chance to talk to him a little bit, get to know him before, I brought him on the air. The thing that I've appreciated is that while I might not agree 100% with everything that he believes in politically, what I do respect about Louis Lang is that one, I'm struck by his willingness to learn. Even last night when we were talking about the Affordable Care Act and Medicaid, there were some things, some concerns, some criticism, some skepticism that he brought up. And I was able to kind of point out to him that, oh, actually the ACA does this or the ACA does that. And then other times when I was able to tell him that, you're right, this is where the ACA did not go far enough. We don't have a single payer system. And it was interesting to actually bring up the point about single payer because, he was not familiar with the terminology, but when I described it to him saying that, well, you could have Medicare for all, or you could have something like, that the Swiss have in Switzerland where, insurance is kind of treated like a utility. It was interesting how he had these moments of like, oh, and what I find so striking about those moments is that it shows to me that that there's a willingness to actually listen and not just wait for your turn to speak again. That there is some openness there to exchange ideas. And even in the midst of, whatever the imperfections are of his politics, the fact that he's willing to learn and that he's willing to engage and converse, I think is actually one of the things that I've come to, respect about him. And I feel like as progressives and liberals and as activists, we can't really be putting these litmus tests of purity of politics at the very beginning. I think that we have to have, a pretty open tent to, welcome people to have conversations. I think we have to venture outside of that tent and find that, that common ground is in places that we weren't really expecting. So, his willingness to learn and my willingness to learn with him, I think has been kind of an interesting experience. The other thing that really strikes me is just his willingness to help. I think that, even as I just now told him, the fact that in the midst of so many health problems and such a, burden, I think that, in the midst of all that health situation, which for any one of us, I think would be more than enough to just, fill up our day and, make us, exhausted, maybe even depressed. I think that, despite all of that, the fact that he wants to help people not face the circumstances that he has been in, I think is really remarkable. I think that's so admirable. And so that willingness to learn and that willingness to help, I actually kind of hope that, if you're a politician watching this, if you're, if you're listening to this and you have any kind of political power whatsoever, I really feel that, that willingness to learn and that willingness to help are just huge. And it would make such a difference if people like Governor Nikki Haley, the South Carolina legislature, would actually follow the example of like one of their own constituents and do right by the people of South Carolina, expand Medicaid, cooperate with, the Affordable Care Act, establish better terms with the federal government to create a healthcare system that actually does right by, the hundreds of thousands of people in South Carolina who, who really don't need the hassle of becoming a policy expert or a finance expert when they're in need of healthcare. So again, I want to thank Louis Lang for coming on the program. I felt that it was a really good interview. I'm glad that we were able to give him a chance to express his own voice. And I want to thank you guys for coming along for that part of the ride. When we come back, we're going to spend a little bit of time talking about Mental Health Awareness Month. And the reason why I'm wearing this green shirt will probably be a little bit more obvious when we are done talking about that. We'll be back in a few. You've been listening to the Dr. America Show here on the WEAC Radio Network. I am your host, Dr. Sanjeev Sriram, and we'll be right back.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
All right. Welcome back to the Dr. America Show here on the WEAC Radio Network. I am your host, Dr. Sanjeev Sriram. And for this segment of the show, I wanted to take some time to talk about National Mental Health Awareness Month. It is May. We are at the very tail end of May, but I wanted to make sure that we spend some time talking about mental health just because it is so important, and it is something that gets overlooked as part of our general health and well-being, and that's also why I'm wearing the green shirt. It's green is the color for the cause, and I want to do my part to bring mental health awareness to the forefront and dedicate a small piece of the show to this really important issue. So for many people, mental health and mental illness are other people's problems. There are a lot of misconceptions, there are a lot of myths about mental health in the United States. And so I'd like to take some time and bust some of these big myths, and so that we can get started talking, and having some real talk about the health of our minds, of the health of our hearts, and to really get into some more productive dialogue as we move forward as a country that is trying to help each other with our mental health and well-being. So let's dive into busting some of these myths. The number one myth that I think that I seem to encounter a lot from my fellow Americans is that mental health or mental illness does not affect me. Nothing could be further from the truth. In any given year, 1 in 5 Americans experiences some kind of a mental health issue. That's 43 million Americans who really do struggle with mental health at one point or another over a given year. And then for 10 million of that 43 million, their mental health challenge is so serious that it actually debilitates them. It becomes a disability. And so it can get pretty serious. When we're talking about 10 million people every year, that is a pretty significant number. And so for people to think that it does not affect you, the numbers really don't lie. And if we look at our young people, for teenagers, these statistics get actually even more serious because, 1 in 5 kids between the ages of 13 and 18 have or previously had a disabling mental illness. That's 1 in 5 teenagers have had a disabling mental illness. It's just incredible. And when you look at, how mental health disorders progress over the course of our lives, half of all mental health illness is giving us first signs before the age of 14. before we turn 14, mental health illness, does present with a few symptoms, which can be very tough to catch, but it's all the more reason why it's important for healthcare providers, nurses, people who are, used to and frequently work with young people to be able to identify, these warning signs because, some of the first ones are popping up before the age of 14 for half of all mental health disorders. And then if you extend that even more, 3/4 of mental health disorders, so that's 75% of mental health disorders are showing some kind of a sign or showing some kind of a symptom before the age of 24. So, this really is, these are the opportunities that we have to reach out, help, and make it so that mental illness is not so much of a burden. It might be a challenge. It might be something that these young people and our fellow Americans are going to be carrying with them for a bit, but it can be manageable. Coming back to the importance of some of these numbers, suicide is number 10 on the top 10 causes of death in America. And if you look at young people again between the ages of 15 and 24, suicide is number 2 as far as the cause of death. And over 41,000 of our fellow Americans took their own lives last year. And, when you put that number in perspective, 41,000 Americans committing suicide, that's about equal to the number of people who died from breast cancer. It's about 3 times the number of people who died from homicide. And it's 6 times the number of people who have, died from HIV. And, that's not at all to diminish the importance of those other healthcare challenges. It's just that I want to kind of help put, the seriousness of mental health and suicide into perspective because, there are these other causes of death. And, I think that mental health and suicide sometimes get looked at as other people's problems, but they actually really do fit in a very big way in the broader picture of American healthcare. So, and honestly, to me, it's like, if you look at all these numbers, we're talking about, 1 in 5 Americans having a mental health, problem over the course of a year, 10 million Americans having such a serious mental health disorder that they're being disabled. You've got so many teenagers who are struggling with it. It's a hell of a lot more than Ebola. And so it's time to really show this issue some real urgency. The second myth that I'd like to bust is that mental illness is dangerous. The vast majority of people with mental health problems are not at all likely to be violent compared to anybody else that's out there. When you look at, violent crime and violent acts that have happened, to people, only 3 to 5% can really be attributed to somebody with a serious mental illness. So, that means that there is 95 to 97% of violence in America is happening that has nothing to do with mental health, issues or mental illness whatsoever. And in fact, it's actually kind of working. It works the other way around. It's that, people with severe mental illness are over 10 times more likely to be the victim of a violent crime. So when you really look at how our paranoia and our misconceptions have flipped us around, where we seem to think that the mentally ill are more dangerous than the rest of us, it's actually the other way around. Is that people with mental illness are actually more vulnerable to violent crime than the rest of us. And the reason why I want to kind of make sure that we're taking the time to talk about mental health and violence separately from next week's episode, because next week I'm going to be covering gun violence as a public health issue. And it's really important to me that we separate, mental health from gun violence. I think that, the big reason why I don't want to conflate these issues is because it really does play into the NRA's game of stigmatizing the mentally ill. You got guys like Wayne LaPierre from the National Rifle Association. He uses words like lunatic and monster when he's talking about people dealing with mental illness and wanting to, keep guns out of their hands. And his idea of improving mental health in America is to create this giant public database with every mental health patient's name in it and to, keep it publicly accessible. And to me, the entire conversation it's just the wrong starting point for a real meaningful change in mental health in America. There's I really don't tolerate language like lunatic and monster. I don't feel that, there's any value added by violating the privacy of millions of Americans who are struggling with mental illness, when in fact, only 3 to 5% of violence in America is attributable to somebody with a mental health, problem. There's a whole lot of, gun violence, a whole lot of, other acts of violence that have nothing to do with mental illness. And so to me, it's really important that we actually separate out mental health from gun violence, just because I think that this idea that we need to keep guns out of the hands of people who are mentally ill, it just sort of furthers the stigma that they are dangerous. I do think that we have to make sure that people who are mentally ill, people who are at risk for suicide, don't have easy access to guns. But to me, I think that we can actually talk about just reducing access to guns in general, and we'll find that we can, help people who are at risk for suicide if we actually just get, lower and reduce the number of guns that are in America. I think that, it is possible to separate out these issues. And I really want to make sure that we're understanding that, people with mental illness are more vulnerable to, violence than they are perpetrators of it. And so, that actually kind of brings me to, one more thing about the stigma before I move on to myth number 3. The other thing about like the stigma of mental illness is that, when you look at, other health conditions in this country that have suffered from stigma, there was a time when we thought cancer was contagious. There was a time when we thought that, HIV was going to, be this like horrible plague that would, ruin us all. And, those stigmas have made it so hard for people with cancer, for people with HIV to get the care that they need. And mental illness is no different. The longer that we allow stigma to, persist, the harder it's going to be to, for people, with these burdens to access the care that they need, and for the rest of us to actually be able to identify and offer our care and compassion to folks. So it's really important to me that we reframe the discussion about mental illness away from stigmatizing language and towards something that's more kind and productive. Okay, so myth number 3. And that is that there's this myth out there that helping the mentally ill is hopeless. And, what they really need to do is just get it together and get over it. Absolutely nothing could be further from the truth. So much of mental illness is treatable. And, I'm speaking from my own experience as a physician. I've watched my colleagues, do, great things for families that have struggled with with a variety of mental health conditions. And it really is a partnership between healthcare providers, patients, families, schools. I think workplaces have, an important role to play. That, there is no such thing as hopelessness when it comes to helping our brothers and sisters who are dealing with mental illness. And what's really tragic is that less than 20% of children and teenagers and only 38% of adults are getting the treatment that they need for, diagnosable mental health disorders. And having watched, and bear witness to, treatment myself, not that I have undergone treatment for a mental illness. It's, to say that I've, taken care of patients who have undergone treatment. It does get better. People are able to, turn their mental illness into something that they can, that they manage and that they are in control of it rather than it being in control of them. It's, it's something that, once through any kind of treatment that you want to talk about, whether that's medication, counseling, therapy where you're talking to a therapist, any of that, every patient is different. So, sometimes they need components of all of those, maybe just one of those. But my point is that when people get the care that they need, they are able to live, lives that are, productive, that are, on their own terms. and that they're able to, fully participate in, their families and their communities' lives. And I really, take issue with the idea that mental health that treating mental health is a hopeless endeavor, because it's simply not true. I think that there's so much clinical experience out there that really actually testifies to the power of just simply helping somebody identify what their mental health issues are, develop a plan with them, and then seeing that plan through so that they can realize their own potential inside. And so it's my hope that watching this segment that you can access some of the wonderful resources that are out there. The National Institute for Mental Health has some fantastic resources. I think that it's really educational even for regardless of how much you know or don't know about mental health. You're going to learn something when you go to the National Institute of Mental Health. And mentalhealth.gov also has fantastic resources for families, teachers, if you're a sibling of someone with mental illness, a spouse, whoever. There's tons out there to learn about mental illness, about how to start conversations, keep up relationships with folks who have these struggles. So please stay inspired, stay active. And the last thing I wanted to share about this segment about the mental illness thing is actually part of like why I'm wearing the Green Lantern shirt. For people who know Green Lantern, the story is that Hal Jordan is this test pilot. And he's recruited by the Green Lantern Corps because they recognize it's this like giant space police corps that is out there to fight evil in the galaxy, and they recruit Hal Jordan, this Earthling, to join their corps because they recognize within him that he has such strong willpower to overcome fear, and that's what they're looking for in the Green Lantern Corps. And a lot of people, probably look at the story and they think that, oh, well, that's what, the mentally ill need to do. They need to find their willpower and, overcome what they've got going on inside and, and just, make things happen and get it together and join the, and join the heroes. I actually kind of feel that the Green Lantern's story is actually not really for people struggling with mental illness. I actually think that story is important for the rest of us. I think that the rest of us need to summon our willpower to overcome our fear of the mentally ill. I think that we need to summon our willpower to build better mental health systems and build mental health care out there. Through our collective willpower. I do think that the story has something to teach us, but I think that maybe we need to kind of revisit the lesson and look at it a little bit differently. So I'm proud to wear green in recognition of Mental Health Awareness Month. I really encourage you guys to go check out mentalhealth.gov and the National Institute of Mental Health to learn more about mental health illness that might be going on in your family's lives, in your colleagues' lives, in your child's life, in your classmates' life. Definitely go check it out. There's a lot that can be done, and we can tackle this. So, thank you so much for hearing this part of the show. When we come back, we're going to be covering some other news topics that are going on in the world of public health and medicine. So don't go away. We'll be right back. You've been listening to the Dr. America Show here on the WEAC Radio Network. I've been your host, Dr. Sanjeev Sriram, and we'll be right back.
You're listening to WEACT Radio, WPWC 1480 AM. Visit us online at weactradio.com.
All right, welcome back to the Dr. America Show here on the WEAC Radio Network. I'm your host, Dr. Sanjeev Sriram. Thanks so much for joining us for this episode. This is the last segment of the program, and I just wanted to kind of cover a couple of important news stories that have been going on in the media recently. And one of those concerns Governor Scott Walker. He's a Wisconsin Republican. I think I'm not 100% sure if he's made up his mind yet about running for president, but it looks like he'll probably join the race. The reason why he made health news was when he decided to go on a bragging spree on a conservative talk show earlier this week. And he talked about how in Wisconsin he's very proud of having signed legislation to defund Planned Parenthood, and that also included signing a law that requires women that mandates a woman get a transvaginal ultrasound or some kind of an ultrasound before she can get an abortion. Now, I'm going to go ahead and tell you like what the governor said, so that it's coming, pretty much, it's his language, his words. So, okay, what he told this conservative talk show host was that we defunded Planned Parenthood. We signed a law that requires an ultrasound, which the thing about that, the media tried to make that sound like that was a crazy idea. End quote. Governor, that is a crazy idea. But I'm going to go ahead and read the rest of your quote, but it's a crazy idea. Okay, the next thing that he said was, most people I talk to, whether they're pro-life or not, I find people all the time who will get out their iPhone and show me a picture of their grandkid's ultrasound and how excited they are, and so that's a lovely thing. I know about my sons are 19 and 20. We still have their first ultrasound picture. It's just a cool thing out there. And then he says, we just knew if we signed that law, if we provided the information, that more people, if they saw that unborn child, would make a decision to protect and keep the life of that unborn child. End quote. Okay, couple of things, Governor. First off, I know what ultrasound pictures you're talking about when it comes to, grandparent, like soon to be grandparents showing off, pictures of the ultrasounds. My Facebook feed is full of, friends and family with, showing off ultrasound pictures and all of that. The thing is that none of them live in a state that mandated them to get that ultrasound picture. They got it because they consented to their doctor and had a good relationship with their doctor, got a copy of the ultrasound picture, and now they are showing it out of pride, and it is out of their own choice to share that with people. So when you say that it's a cool thing that's out there, yeah, it's cool because the patient consented to it, their doctor helped them, and they were able to share what, they agreed upon as doctor and patient, and they're able to share what they have decided for themselves about wanting to be a parent. So do you see what I'm saying here about like how it's cool when you get a choice in the matter, that, that sharing that, photo and everything, that it can be a source of pride. That is not what your law in Wisconsin and many other states, there's about 23 states that are like doing this kind of nonsense to women, mandating that they have to get this ultrasound. You're not trying to you're not trying to instill pride. This is about shame. This is about controlling women's bodies. This is about, sticking your, misogyny in the doctor-patient relationship where it really, really, really does not belong. I can tell you right now, I have counseled a number of young women over the course of my short medical career. And I can tell you that, the decision of whether or not to keep a pregnancy it is gut-wrenching, it is heart-wrenching. And, to be the physician in that situation, all you're trying to do is to, look after your patient. All you're trying to do is, give them the information they need so that they can make a decision one way or the other. And that, your hope as their healthcare provider is that, that you're giving them the best information possible so that their decision, however they want to go, is the most informed decision, that decision fits into the context of their individual life as a woman, as a young woman, who may or may not want to go through with a pregnancy. I mean, that in and of itself is is a lot. It's a lot. I mean, it's a lot for the patient. And yes, there is like a lot of responsibility and duty for, the healthcare provider, but it's so much for the woman as it is. I feel that I have seen so many women wrestle with, whether they're ready or not to be a mother. And I don't think that it's really like any of your place, Governor Walker, to intervene on that conversation. To then say that you must get an ultrasound, that you're going to mandate that somebody probe this body in order to, what you think is going to instill something that it really doesn't. It really doesn't. In fact, the American College of Obstetricians and Gynecologists and a whole bunch of other women's health experts all got together, and what they found was that women who get these mandatory ultrasounds, or who hear or see things about the ultrasound, are not necessarily persuaded one way or the other about their decision to follow through with an abortion. It does absolutely nothing. Number one. Number two, the other thing that they found is that it's so disruptive to the doctor-patient relationship because it's requiring that the doctor say something to the patient that does not fit into the context of the conversation that they have been establishing so far. Some of the laws in some of these states are actually telling the doctor to, they're actually forcing the doctor to lie. They're actually like telling the doctor that they have to tell patients misinformation. Maybe not about an ultrasound, about whether you can get your abortion reversed. In Arizona, you can, as a doctor who is performing an abortion, is going to be required to tell the patient that it can be reversed with medication, which is simply not like a proven thing in the community of science. That is not like standing up to the evidence base that is out there. But doctors are going to be forced to say that to a patient. I mean, you cannot, there's so much that is already complicated about the doctor-patient relationship in terms of how do we take complicated science, break it down in a way that is understandable so that the patient is fully informed about their rights, about their condition, about their, about the decisions that are in front of them, the consequences of those decisions. There's so much there that has to be figured out between doctor and patient, that things like a mandatory ultrasound actually does nothing to help that guide, that conversation at all. It's about instilling your, misogyny, what you think this woman should decide is like, that's what this law is about. Has nothing to do with protecting, with protecting a pregnancy. It's about turning her decision into something that could be potentially shameful. And the sad thing is, Governor Walker, are you going to be there, for, this mom and this kid, if they decide to go through with it? Are you going to be there for them when they are going to be needing healthcare, when they're going to be needing, the things that they need? Because I got to tell you, some of your decisions in Wisconsin, not unlike a lot of other governors across the country, really do make me wonder how much of this is about women's health, how much of this is really about child health, because you're not really doing enough to stand up for things like Medicaid. You're not really doing enough to stand up for things like sex ed, which would actually not even bring this woman to this place if she actually was given, proper, sex ed, from the, beginning of her experience as a woman. You're not really doing a lot of these things that would actually do wonders, proven wonders, to reduce the number of abortions in this country. Instead, we're going to be forcing women to undergo procedures that can be very uncomfortable, that can be costly, and that have no contribution to the doctor-patient relationship. If I'm sounding particularly upset about this, is because I actually feel that this is such a violation of my work, with my calling with my patients, that it's really hard to stand by and, hear it be called just a cool thing that's out there. I really feel that just speaks to the ignorance of, your understanding of something that is so fundamental to the doctor-woman relationship, that I really feel that you need to revisit this policy. It needs to be repealed. It needs to be challenged for sure in the courts, and that we need to do better, as Americans for each other. If you're one of my fellow Americans who is actually supporting, these kinds of policies, or if you're supporting these kinds of politicians, maybe not their policies, I just want to have a quick word with you about this idea of being socially liberal but fiscally conservative, because I hear that a lot of folks like guys like, Governor Walker. They used to like guys like Governor McConnell. There's a whole lot of governors out there like Governor Christie who, seem to be building this like weird following of people who are socially liberal but fiscally conservative. I can tell you right now that that phrase is absolutely useless and meaningless. It has nothing to do with reality of what I am dealing with as a healthcare provider. It has really nothing to do with the reality that my patients are dealing out there in the real world. Because the truth is that you can't really strip apart, social policy from economic policy. I get it that, you're not like a big fan of taxes. I don't think anybody is a fan of taxes, but, let's look at this entire show that we've been talking about so far. Louis Lang's situation in South Carolina is because, we have this attitude that we don't want to, that we don't want to fund things like Medicaid and save that man's eyesight. The part about Mental Health Awareness Month, that is going to require tax dollars so that we do a better job and that we're not leaving the stats were terrible. Less than 20% of kids are getting the treatment that they need for mental health condition. Less than 38% of adults are getting their treatment that they need for diagnosable and treatable mental illness. Those things, yes, they do cost money, and yes, they do require entities like Medicaid to do their job, because we're clearly hearing from the insurance companies that it's too expensive for them to do any of this work. So yes, it is going to require taxpayer dollars, and that does, it runs anathema to fiscal conservatism, because that is important spending. That is spending that is based on the values of American justice. To be socially liberal, you might feel that, that you don't want this woman in this situation in Wisconsin to be forced to get an ultrasound. You might, that might not, make you feel very good. As far as if you are a social liberal, but are you willing to make her undergo that because somebody like Governor Scott Walker is willing to, keep your tax bill low because he's that kind of fiscal conservative that that you really want? And I know that might not seem like a fair choice, but that is but those are the circumstances of the politics that we are in right now. We don't really get to have leaders who, cut down your tax bill and make it okay for all of these, for all of these patients, women who are needing their reproductive health rights, people like Louis Lang who are struggling with their vision, people with mental illness to get the help that they need. They can't get the help that they need, and you can't have a super low tax bill all at the same time. That is simply not going to happen. So it's time to get real about our politics in this country. We've got a lot of interesting people running for, the presidency, but I think that we have to actually kind of look at their track record and ask them, what are your priorities here? Because, I'm willing to pay my taxes if it means that we're doing better than less than 20% of kids getting their mental illness. I'm willing to pay some tax bills so that, people like Louis Lang aren't losing their vision and their personal fortune because of, the broken healthcare system. I'm willing to pay a few taxes so that this woman, in Wisconsin, is actually being given scientifically based information before she makes one of the toughest decisions in her life. Those are where my values are. That's where I want my candidates to stand. And I get it that, we can't have everything that we want, but I feel that the sacrifices that we make are worth it for the values that we can uphold, especially when it comes to health justice. So please, think about these issues not as independently strung out things, but to understand that they are part of this web of mutuality. It is happening in a political climate, and as more and more people decide to enter, this pool of candidates that want to become president, I hope that that we keep the tough questions rolling, because it's only by having tough questions and complicated answers that we can actually build some progress. I know that this last segment of the program might not have it's ending in a way that maybe we didn't expect it to end, and I really appreciate everybody's patience for hearing this out, but I do feel that there is a thread that connects all of these issues, and I appreciate your time to hear me out on this. We're gonna next week we're gonna be talking about gun violence. June 2nd is, please make sure you wear orange. Everytown USA to Prevent Gun Violence is leading a major campaign. It's going to be their first annual National Day to Prevent Gun Violence. It's going to really raise awareness about an important public health issue. So wear your orange, wear your support, and come back to the Dr. America show to learn more. That's going to be it for today's show. My name is Dr. Sanjeev Sriram. I've been your host for Dr. America on the We Act Radio Network. And until next week, salud to your health.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
If you're a veteran of Iraq or Afghanistan, like me, coming home can be harder than expected. But it turns out I wasn't alone. At IAVA.org, there's a free online community of thousands of vets who've got your back.
Whether it's managing the transition home or everyday stuff
like finding a nice sweater for my dog.
Sweater?
Okay, maybe not that. Iraq and Afghanistan Veterans of America is there for you. Join our community at IAVA.org.
We've got your back.
Brought to you by IAVA and the Ad Council.
I'm a third grade teacher.
I'm a school bus driver.
I am a parent.
I am a teacher's aide, and I agree to be identified
as a caring adult who pledges to help bullied students.
I will listen carefully to all students who seek my help
and act on their behalf
to put an immediate stop to bullying.
I will work with other caring adults to create a safe
learning environment for all the students in my school.
In my school.
In my school.
In my school.
I'm Dennis Van Rokel, president of the National Education Association. Help us create safe, bully-free learning environments for all students. One caring adult can make all the difference. Be that adult and take the pledge at NEA.org/bullyfree. Adults have the power to stop bullying in our schools.
It starts with me.
It starts with me.
It starts with me.
It starts with me.
Bully-free. It starts with me.
Visit NEA.org/bullyfree. A message from the National Education Association.
Let me tell you who to blame. Blame the boy lying at your feet, his body oozing life through the hole in his stomach where the bullet tore him apart. Blame him for challenging you, for not looking away and for not backing down when you pulled out the gun. Blame your mother for bringing you into this world when she was but a kid herself and for dragging you up, not bringing you up. Blame society for not giving you hope. Blame your father for not being there, the man who looked after himself instead of looking after you. Blame the gun in your hand for making you a target, for making you more likely to be picked on. Blame the dead boy, blame your mother, blame society, blame your father, blame the gun, blame anyone but yourself for not being strong enough to put down the gun, to break the cycle.
This entire piece of music is played with only two instruments, a right hand and a left hand. Hands can do incredible things, but nothing compares to using them to help save a life with hands-only CPR. If an adult suddenly collapses, call 911, then push hard and fast in the center of their chest until help arrives. Hands-only CPR is recommended by the American Heart Association, and it's incredibly easy and effective. For more information on hands-only CPR and to make your own hand symphony track, visit handsonlycpr.org today. The power to help save a life is in your hands. A message from the American Heart Association and the Ad Council.
Hello, my name is Jim Gray, and I am a judge of the Superior Court in California and a former federal prosecutor in Los Angeles. I would like to talk to you for a moment about marijuana. Did you know that since the federal government first banned marijuana in 1937, usage in this country has actually gone up by about 4,000%? Or did you know that in the Netherlands, where adults are allowed to possess small amounts of marijuana and buy it from government-regulated businesses, fewer adults and fewer teenagers smoke marijuana than here in our country? Or that an American is arrested on marijuana charges every 38 seconds? If you are wondering if any of this makes sense, you are not alone. To find out more, contact the Marijuana Policy Project at 1-877-JOIN-MPP or visit them on the web at mpp.org. Thank you, and good luck to us all.